Welcome to the playlist of NPTE exam. In this lecture, I will discuss the 10 MCQs. The first MCQs is strain and sprains are among the most commonly reported musculoskeletal injuries. These injuries account for about 50% of the work-related injuries. Sprain is of the ligament and the strain is of the muscle or a tendon. Remember this? They are the commonly interchanged, but they are two different injuries. Which of the following statements are correctly describe these injuries? The option B, sprain is characterized by increased pain with the joint movement. Here, option A, you can see strain and below there is written ligament. However, ligament injury is sprain. Here it is same, sprain is of the ligament, and here it is the strain condition. Strain can cause joint instability, no sprain can cause joint instability. So the all the options are incorrect. The correct option is sprain. The ligament injury is characterized by the increased pain with the joint movement. Option B, sprain is characterized by increased pain with the movement of joint. Sprain involving ligament injury because of this sprain can cause instability of the joint. Strain is characterized by the stretching injury to a muscle. It is characterized by increased pain with isometric contraction of the affected muscle when we hold a specific position in which muscle length remains same. So increased pain in case of strain in this condition. So the correct option is sprain, increased pain with the joint movement. MCQs number 2, the shoulder is able to maintain great mobility with limited stability due to the static stabilizers which maintain congruity and the dynamic stabilizer which create compressive forces at the GH joint, glenohumeral joint and or the shoulder joint. Which of the following is a static stabilizer? Glenoid labrum is the static stabilizer in this condition. The labrum is a static stabilizer. It includes bony structures, glenohumeral ligament, and the joint capsule. The rotator cuff muscles are supraspinatus, infraspinatus, teres minor, and subscapularis. These four are rotator cuff muscles. They are involved in the rotations. Medial and the lateral are internal or the external rotation of the shoulder. Scapular stabilizers, rhomboids, and serratus anteriors are dynamic stabilizers. Scapular stabilizers are rhomboid and the serratus anterior help in the pronation of the scapula, protraction of the scapula. They are the dynamic stabilizers. MCQs number 3. When utilizing heat modalities, the physical therapist consider the different conductivity properties of the each muscle type. Which of the following muscle has highest thermal conductivity? That is of skin. Skin has the highest thermal conductivity. Thermal conductivity of the tissue are the following: skin 0.94, skin has 0.94, cortical bone has 0.80, muscle is 0.60, and the adipose tissue there is less 0.19. Thermal conductivity is the material's ability to conduct heat. Okay, thermal conductivity. What is thermal conductivity? Is the ability of a material to conduct a heat. MCQs number 3. A female patient revealed that there are times when her hand usually fall asleep. On history taking, the patient says that things usually slip from her hand without her noticing. Numbness is usually severe at night. CTS or carpal tunnel is considered. Physical therapists understood that this condition is characterized by a nerve. CTS, median nerve pass. When the median of compression, there is a symptoms of carpal tunnel syndrome. It is characterized by damage or impingement of a median nerve. This run nerve throughout the carpal tunnel. High pressure within the carpal tunnel due to any reason can cause damage to the medial nerve, and it is most common in the females and in pregnancy. Whites have the highest risk of developing CTS. MCQs number 4. Exercise is an essential part of anterior shoulder dislocation rehabilitation program, as it can have positive effect on the muscular tissue and the muscular strength. Physical therapists gradually initiate a group of exercises that include constant velocity of shoulder movement with variable resistance. Note this, with variable resistance. The resistance is given throughout the muscle action to allow maximum tension. When the resistance is increased tension, this type of exercise is isokinetic. Everyone knows when there is resistance to a in range of motion, incomplete throughout range of motion, this is the isokinetic exercise, which have constant velocity of movement with variable resistance employed throughout the muscle action. This type of exercise allow maximum tension throughout the range to encourage motor recruitment. Isometric exercise. What is isometric exercise? In which there is a constant joint position given in the variable resistance without changing muscle length. There is no increase or decrease in the joint angle. What is isotonic exercise? It is the composed of dynamic exercise that combines constant load with uncontrolled speed of movement. Endurance exercise increase a muscle ability to maintain or repeat a contraction within a period of time. There is a repetition in the endurance. This difference you can note here. And the correct option for the variable resistance, it is variable resistance, constant velocity, then it is isokinetic. MCQs number 5. Formation of thrombus and its manifestations are related to an inflammatory process. When thrombus develop, inflammation occurs. The inflammatory process causes the thickening of the vein walls. Which of the following type of venous thrombosis is associated with the veins inflammation caused by an invasive procedure? When there is veins inflammation, there is a phlebitis. Itis means inflammation. Phlebitis involve veins inflammation caused by an invasive procedure. There is cut, such as the insertion of intravenous lines. Varicose veins are manifested by the distension and the protrusion of the veins. Remember this. Thrombophlebitis is an thrombus associated with the inflammation, and phyllothrombus is the thrombus without an inflammation. These are the differences. Phlebitis is the vein inflammation. Varicose vein is the distension and protrusion of the veins. Thrombophlebitis, there is a thrombus formation, and there is itis means inflammation of the veins, and phyllothrombus, there is a thrombus without an inflammation. MCQs number 6. Most cases of lumbar disc herniation are associated with the natural aging of the spine. Experts believe that disc herniation is caused by an drying out and the weakening of the intervertebral disc. The following factors increase an individual risk for a disc herniation except female gender. There is a less common in females. Males have, especially 30 and 50 years, are more likely to develop herniated disc. Frequent lifting heavy weights using the back muscles, constant spinal rotation, bending, pulling over, being overweight may increase the risk factor of this condition. Other factors may include sedentary lifestyle, frequently driving, and the smoking. These are the risk factors that are associated with the male gender. Bronstrom classifies the stage of motor recovery into the 6 stages. On assessment, relative independence of limb synergies and waning spasticity are noted on the patient affected side. Arm raising to a side horizontal position and bringing of the arm over the head are also recorded. These findings indicate what type of motor recovery is. If there is bringing arm raising to a side horizontal position and bringing of a hand over the head, this is the stage 5. The findings indicate stage 5 of motor recovery. In stage 2, this is characterized by the development of basic limb synergy with no voluntary movements, with no will. There is a no voluntary movements. In the stage 3, this is characterized by the marked spasticity. In stage 3, there is a marked spasticity. Stage 4, decreased spasticity with absent sign of relative independence of limb synergy. While in case of stage 6, there is isolated joint movement. Here are the stages of motor recovery. A physical therapist is assessing the skin of an elderly patient who is recently referred for physical therapy. Understanding the normal age-related changes of the skin or integumentary system. An elderly patient is at risk of the following conditions except increase wound healing rate. It is not at the risk of this. Here is the answer. Wound healing rate decrease with the aging because how? In addition to thinner, less protected and inelastic skin, at the aging there is inelasticity with decreased layer of a fat. This is also a changes occur. Blood vessel changes, lower immunity may slow down the process of healing. Wound in the elderly may heal 4 to 5 times more slower than the younger individual when healing is delayed. The risk for pressure ulcers or infections increase. The elders are also at risk for easy bruising, mainly due to thinner inelastic and reduced fat tissues. There is a risk of ulcers and infections increase. The number of the sweat glands decrease with the age, causing the elders to sweat less, and in winter they feel cold more. This change make the elderly insufficient in regulating their body temperature in hot weather. Okay, option D is correct. Weather wound healing rate decrease with the aging. MCQs number 8. A 55-year-old non-athletic and healthy patient is referred for an exercise program. For beginning, a good target heart rate should be 960% of the maximum heart rate, which is the correct target heart rate during the exercise for a patient. In case of exercise, during exercise, what should be the heart rate? Normal is 60 to 100 and approximate, and if I tell the exact figure, that is the 72 for a normal person, and in case of exercise it's 99. The target heart rate for a patient during exercise is 99. The target heart rate is obtained by using the following formula. How you can do it? You can 220 minus what's the patient age? It's 165 multiplied by 0.60 in each minute, and its total is 99 heart rate per minute. And in this lecture I will discuss all these MCQs. Now next we will discuss the MCQs related to the therapeutic modalities. Our first part is complete. I hope so you like this video.